Lower your high blood pressure. Blood pressure is the force of blood against the walls of your arteries as your heart pumps it throughout your body. High blood pressure, also known as hypertension, can be a serious health concern and is often called the silent killer, because it may not have noticeable symptoms until it reaches a dangerous level. Signs and symptoms of high blood pressure. Often, people don't feel any obvious signs or symptoms of high blood pressure. Very high blood pressure can cause headaches, blurred vision, chest pain and other symptoms. It's essential to have your blood pressure checked regularly, especially if you have risk factors such as a family history of hypertension, obesity, or a sedentary lifestyle. Causes and risk factors of high blood pressure. 1. Age. Blood pressure tends to increase with age. 2. Family history. If your parents or close relatives have high blood pressure, you may have a higher risk. 3. Obesity. Being overweight or obese can increase your risk of hypertension. 4. Physical inactivity. Lack of regular exercise can contribute to high blood pressure. 5. Unhealthy diet. Consuming too much salt, unhealthy fats, and low levels of potassium can raise blood pressure. 6. Smoking and alcohol. Both smoking and excessive alcohol consumption can elevate blood pressure. Treatment of high blood pressure. Treatment for high blood pressure may include lifestyle changes and/or medications. If you have been diagnosed with hypertension, it's essential to follow your doctor's recommendations closely. They may prescribe medications, such as diuretics, beta blockers, ACE inhibitors, or calcium channel blockers, to help control blood pressure. If blood pressure is not properly controlled and remains consistently high over time, it can lead to a variety of serious health risks and complications. High blood pressure, hypertension, is a significant risk factor for several cardiovascular and other health conditions. Some of the potential health risks associated with uncontrolled high blood pressure include heart disease. High blood pressure can damage the arteries and increase the workload on the heart. Over time, this can lead to the development of coronary artery disease, heart failure, and other heart-related problems. Stroke. High blood pressure can cause the arteries in the brain to weaken or become narrowed, increasing the risk of a stroke. A stroke occurs when there is a blockage or rupture of a blood vessel in the brain, leading to reduced blood flow and potential brain damage. Kidney damage. The kidneys play a crucial role in regulating blood pressure. High blood pressure can damage the blood vessels in the kidneys, reducing their ability to function properly. This can eventually lead to chronic kidney disease or kidney failure. Vision problems. Uncontrolled hypertension can damage the blood vessels in the eyes, leading to vision impairment or even blindness. Peripheral artery disease, PAD. High blood pressure can lead to the narrowing and hardening of the arteries in the legs and other extremities, causing reduced blood flow and increasing the risk of peripheral artery disease. Aneurysms. Chronic high blood pressure can weaken the walls of blood vessels, leading to the development of aneurysms, bulges in the arteries that can rupture and cause life-threatening internal bleeding. Cognitive decline. Some research suggests that uncontrolled hypertension may be associated with an increased risk of cognitive decline and dementia in older adults. Sexual dysfunction. High blood pressure can contribute to erectile dysfunction in men and reduced libido in both men and women. Metabolic syndrome. Uncontrolled hypertension is often associated with other risk factors, such as obesity, high blood sugar, and abnormal cholesterol levels, which together form metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. Blood pressure levels are usually expressed as two numbers, such as 1/128th of a millimeter of mercury. These numbers represent the pressure in your arteries during two different phases of your heartbeat. Systolic pressure, top number, This number represents the pressure in your arteries when your heart contracts and pumps blood into the arteries. Diastolic pressure, bottom number. This number represents the pressure in your arteries when your heart is at rest between beats. Normal blood pressure, systolic, less than 120 mmHg. Diastolic, less than 80 mm of mercury. Elevated blood pressure, systolic, 120,129 mmHg. Diastolic, less than 80 mm of mercury. Hypertension, high blood pressure, stage 1, systolic, 130,139 mmHg. Diastolic, 80-89 mmHg. Stage 2, systolic, 140 mm of mercury or higher. Diastolic, 90 mm of mercury or higher. Hypertensive crisis, emergency, systolic, higher than 180 mmHg. Diastolic, higher than 120 mm of mercury. It's important to note that a diagnosis of high blood pressure is usually based on multiple readings taken over time. Sometimes, your doctor may ask you to monitor your blood pressure at home to get a better understanding of your average readings. If you have consistently high blood pressure readings, it's essential to work with your healthcare provider to develop a management plan. Lifestyle changes, medications, or a combination of both may be recommended to bring your blood pressure within a healthy range and reduce the risk of complications. Foods to help control and reduce high blood pressure. Potassium-rich foods include fruits and vegetables like bananas, oranges, potatoes, sweet potatoes, spinach, and tomatoes, as potassium helps balance sodium levels and reduces blood pressure. Foods high in calcium and magnesium. These minerals may help regulate blood pressure. Good sources include dairy products, leafy greens, nuts, and seeds. Dark chocolate. Dark chocolate with a high cocoa content may have beneficial effects on blood pressure due to its flavonoid content. Whole grains. Foods like whole wheat, oats, and quinoa are good sources of fiber and can help maintain healthy blood pressure. Fish. Fatty fish, such as salmon, mackerel, and trout, are rich in omega-3 fatty acids, which can promote heart health and lower blood pressure. Garlic. Some studies suggest that garlic may have a modest effect on blood pressure. How to control and reduce blood pressure naturally. Maintain a healthy weight. If overweight, losing even a few pounds can help lower blood pressure. Regular exercise. Engage in at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. Reduce sodium intake. Limit processed and high sodium foods and use herbs and spices for flavor instead of salt. Limit alcohol and quit smoking. Both can raise blood pressure, so reducing or quitting these habits can be beneficial. Manage stress. Chronic stress can contribute to hypertension, so practice relaxation techniques like meditation, yoga, or deep breathing. Monitor your blood pressure regularly. Keep track of your blood pressure at home and report any significant changes to your healthcare provider. Remember, it's essential to work with your healthcare provider to develop a personalized plan for managing high blood pressure. They can help you determine the best course of action based on your individual health needs. Thanks for watching.